Cancer is one of the diseases in Nigeria where support is not as at the point where we would like it to be. First of all, the diagnosis, the awareness, people don't know. When they know late, and even when they know where to go. So we started working in awareness at the Medicaid Cancer Foundation, and then we realized that how can you help people? How can you ask them to treat themselves when the facilities don't exist, when the medication, they can't afford it, and the distance between where they have to go for care is significant. So we started doing our own bit to try and bridge that gap, and one of the ways is what gave birth to the PACE program, where we work with partners, including our own Medicaid Diagnostic Center, to provide solutions for cancer patients. We work with the pharmaceutical companies to reduce the burden and the financial load of treatments on them. As a foundation, we raise funds and we subsidize the cost of chemotherapy, of diagnostic, of monitoring and evaluation tools, tests for cancer patients.
I was diagnosed 2022, and it's never something you're prepared for. Diagnosis is not something you're well prepared for at all. It's like a wave that, you lose your ground. Immediately they tell you that this is it. I was so devastated. I was in anguish. It's a painful period that we really do not even like talking about it, but it's something we have to do. I was drained emotionally, physically, even financially. Because, year in, year out of medical challenges and all that, you'll be wondering where would you start from. So I got to find out about Medicaid, and somehow I was welcomed into this family. The team, I was introduced into the PACE program, and somehow they came through for me. They always come through for me. At that point that you feel it's all over, that is when somebody will be pulling you up. So that was what I experienced with Medicaid, because at that point, during that PACE program, I was left with nothing. With a A2 positive, I'm an A2 triple positive. So at that point, I actually needed money for accepting, and I was not getting it. And all out of nowhere, I was called, and that was how the whole journey started for me with Medicaid. So they've always been helpful, supporting me mentally, physically, and financially. The PACE program was one of the major programs that they introduced me to immediately I came in here. But even at that point, we were plenty that came in. We were told to be patient because there were plenty of people that they need to stop, they need to, help. So I was patient enough, and I got financial assistance. I'm trying to be plain. I got a financial assistance that really, really helped me. And even after that, they always call me for any major programs they have that they know that, okay, I can actually benefit financially.
The beautiful thing about what Medicaid does is that it's beyond the individual patient level. I mean, it's good if I'm supporting a patient to get her treatment, do you understand? But we might be able to, as a foundation, support 5 to 10 patients out of the hundreds of other patients that are out there. And that's why the policy and advocacy that Medicaid does comes in. I mean, it's because of things like that, efforts like that we have a cancer health fund now from the government. So even if we're not able to support a patient directly, they can benefit from that. It's because of the efforts of advocacy that we have a chemotherapy access program. So you have medications being discounted at the federal medical centers, and patients can access that. So even if it's not coming directly from Medicaid, it's from the advocacy.
I have actually partnered with Medicaid as an individual for I think over 8 years. Because I am not just an oncologist, I also had, my sister. So I had this other side of me that just wants to advocate for patients, awareness, especially young female patients that come down with cancer, breast cancer. So that was just my drive at that time. And so Medicaid was one of those NGOs that did annual, and they were very constant with it, annual WALKAWay Cancer, and I felt that that was a platform for me to do advocacy, support patients, spread the news and all that. And so I did that for some time with them. I was attending like annually until I got to Federal Medical Center and started the oncology department here, and Medicaid was partnering with the hospital, and so it became like on a larger front.
It's been over 16 years rolling, and it all started from being the diagnostic center, Medicaid radio diagnostics, and we had mammogram, we had pap smear investigations, and people would come and run the mammograms and then would say, what next? They found a lump, what am I supposed to do next? So there was this gap that existed that needed to be filled in terms of patient navigation and what to do next. So that's basically how the foundation metamorphosized into what it is now. I mean, the impact is enormous. Like, it's even hard to quantify. I can't say there's a data that numbers all the patients we have seen, but our impact is vast, covering from patient support, to screening, to diagnostics, to treatment support, to palliative, to psychosocial support, to capacity building. It's a myriad of so many things.
WALKAWay Cancer was actually my first. I have never attended any program, but that last year I was so excited being part of it. Like, I was all over the place, knowing that I have a team. The WALKAWay Cancer brings not just the cancer survivors, but people who don't even know what this whole thing is all about, but they come at that period and they learn about cancer. That's part of creating awareness. They learn about cancer, they learn about teamwork, survivorship, and actually the people we've lost, they also honor them in their home ways. So it was really, really a huge program for me.
I recently learned that because of the surgeries I had to undergo, that I'm not able to carry my own children anymore. So that is why I'm also a big advocate for the HPV vaccine, and I want to encourage everybody, especially parents of young girls, young females, to check the options for get the HPV vaccine.
I was diagnosed in 2022, precisely February. So during this awareness, sometime in February, cancer awareness specifically, so I decided to go to Medicard for a screening. So I found out that I had a lump. Although it was not conspicuous, but I just sensed that there was more to it. I decided to go for a check, and I was told I need to go for a biopsy to confirm what it was all about. So when I went for a biopsy and further examination, that's histology, the histology came out that I had cancer, breast cancer, invasive ductal carcinoma. So the screening and the awareness program actually facilitated my early detection.
I represent Mano Springs Medicals, and we've been participating in this Medicaid cancer work for like 2 years now. This is our second event with Medicaid for this work, and the impact of this cancer work cannot be overemphasized. In my point of view, I feel that the impact of this program, of this event, cannot be overemphasized. One, it helps to give a lot of awareness about cancer, because a lot of people here in Nigeria don't know anything about cancer. Many people still have the ideology that it's white people that suffer from cancer. Medicaid cancer work has helped a great deal to provide awareness about cancer in Nigeria, and the screenings as well. It has helped many people that I know to detect cancer early, and then we know that once you detect cancer early, the chances of survival is high.
WALKAWAY Cancer started in 2014. So I remember our founder calling us together in a meeting to our office to say, oh, she has this bright idea, having a 5-kilometer walk, and we're all looking at her like, okay, because it wasn't something that was so common in Nigeria at the time. And even if it was common, it wasn't like televised, so we don't know about it. So she's like, oh, they do it abroad a lot, like the Race for Cure and so on. So she thinks that bringing it to Nigeria will be very impactful. So that's how the walk really was, initiated. And then we started, what started as an in-house discussion became what it is today, that we have to bring advocates from all over the world to be a part of. So it's been a fantastic movement so far, and the impact is again enormous. And we raise funds. That's our major fundraiser for the year. We have a lot of donations from people, corporate organizations, even some government organizations would all want to key in. And yes.
The WALKAWAY Cancer is about honoring heroes. That was our theme for the 10th walk this year, in 2024, the last one. But it's really a walk that is encompassed of so many different aspects. It's an awareness walk. You can see how the numbers of people that turn out all through, before, leading up to the month of October. We spend months creating awareness, talking about cancer, the signs and symptoms, what to do when you have it, educating people, the general population. And then we use innovative methods like celebrities, like high-level influencers, policymakers, to attract even more people to the walk, so that when they come or they go to our pages, they can learn more about cancer, all in a fun and entertaining way, a cultural entertainment, different forms, modern entertainment. The young people are very fond of it because we have a lot of singers and stars that come and perform during the walk. So the walk is also a place where we can raise funds. That's a significant part of it. We raise funds that we use to subsidize that treatment that we spoke about earlier. We raise funds to help cancer patients, to spread the message more, and so many other things. So by partnering with different companies, this time we don't focus on the pharmaceutical ones. We go to, as long as it's ethically acceptable, we go knock on doors and we ask people to use their CSR. It also awakens the spirit of corporate social responsibility in our organizations in Nigeria. When you have a credible platform, a very good cause that everybody is affected by, people are ready to give to that cause.
Talk about challenges. I mean, anybody in the cancer space will tell you that there are a lot of them, truly. I mean, where do we start from? At the very low level, we have all the awareness that we've been talking about, the stigma that surrounds it, the willingness of people to actually even listen to the conversation of cancer. Are they even willing to hear you? Or say, God forbid, it's not in my family, so I don't need to talk about it. Are they going to be willing to come out for screening programs? And when they do come out for screening programs, we do not have a national screening program. A lot of the screenings, we have free screening events organized from time to time by different institutions. Medicaid is one of them. But today, if a woman just decides randomly to go and screen, it's going to cost some amount of money. Everybody should be an advocate for cancer. And I'm happy to see that. Medicaid is a leading foundation. Wherever you talk about cancer in Nigeria and you mention Medicaid, everybody will, because we are the pioneers, and we started this conversation even when it was still taboo to talk about certain things, starting with breast cancer, going into the communities. And I'm very honored to be able to be part of that work. Today I'm happy to see that more people are joining, even clinicians, that will typically before just be in the hospital part of it, are becoming advocates. Young people, secondary school aged girls and boys, the NYSC core members, everybody is joining in the advocacy, trying to be a part of the conversation. It's really heartwarming.
Because we are not stopping WALKAWAY Cancer yet, so I won't say a legacy we are leaving behind. It's something that would outlive us. You know, if you notice, a lot of other organizations are now doing work for something, work for this, work for that. Everybody's keen into the aspect of work as a good, awareness, activity now. So it's a legacy we are proud of. WALKAWAY Cancer is trademarked. It's on the Abuja calendar of the year of an activity that happens every year. So it's on its own and it will keep growing.
There's a lot to ask, but I think that we have the capacity, we have the determination, and for us at Medicaid Cancer Foundation, we're going to do a lot more in the next 10 years.
I want to thank Medicaid for what they've done so far in my own treatments, and for other people who have brought and they've also, looked into their cases. Thank you so much, Medicaid.